Let's continue with the next study, and this one is very important. This doesn't concern COVID-19 vaccines. It concerns regular flu vaccines. And we hear all the time that, come on, take flu vaccine, that will protect you. But it seems that is not that way.
Yes, absolutely. Now, this is a study that is a preprint. So we should clarify this, that this is, most of our studies that we're talking about today are peer-reviewed. This is a preprint, which means it has not been peer-reviewed yet, but it has been published on the largest preprint server for the health sciences called mRxiv. The title of the paper, Effectiveness of the Influenza Vaccine During the 2024-2025 Respiratory Viral Season. So it's looking at data that is very recent from the cold and flu season that just ended. And the authors of this paper, from what I understand, come from the Cleveland Clinic. The Cleveland Clinic is one of the largest, medical treatment and research facilities in the U.S. They have a website that is very widely referenced, even by doctors and medical professionals, with a lot of information about all sorts of, health issues, diseases, and so on. But focusing on the findings of this paper, even if it is still in peer review, so a preprint, the intent is that it will be submitted to journals. Maybe it already has been submitted for consideration, and then it will eventually be published. According to this paper, they found that people that received a flu vaccine for the 2024-2025 flu season had a 27% higher risk of getting the flu. So you get the flu vaccine thinking that it will protect you against catching the flu. And this study says that the opposite is occurring. It increases your likelihood of getting the flu. How did they do the study? Here we're talking about a big sample. So we can eliminate that criticism from this paper. They looked at the records of all of the employees of the Cleveland Clinic. So this is over 50,000 employees. About 82% of them received the flu vaccine during the study. So you have a large sample of total people. You have a large sample also that were vaccinated, and you still have about 1/5 of the sample almost that was unvaccinated. So there's a lot of data to work with over here. And they studied those individuals for 25 weeks, or 25-week period. And that's how they came up with their determination that those individuals that did get the flu vaccine, and these were the flu vaccines that were made for this year's flu virus, or the one that was expected to be the most common strain of the virus, had this 27% higher risk, which translated to a negative effectiveness rate of 26.9%. Now, this is important because medical professionals are oftentimes required by their employers or by laws in their regions to be vaccinated for the flu vaccine. My understanding is that among the Cleveland Clinic sample, those people that were not vaccinated were ones that had gotten exemptions because the Cleveland Clinic allowed exemptions, so employees to request exemptions for health reasons or religious reasons. Not everyone does that, but in this case, Cleveland Clinic did. So you had some employees that were not vaccinated, and that led to this very good data set that could be compared for vaccinated and unvaccinated people and their outcomes.
Well, there is a message for audience next year when they will tell you to take vaccines. Just ask them, do you have more chance to get flu with vaccine or without? And if they say there is a less chance, ask them proof, because you can see here proof that it's opposite.